Tonight in this special program, we pick up where the news has left off with the only thing that people are talking about, coronavirus. What was an obscure scientific term a few weeks ago has come to define a global crisis not seen in generations.
Many more families are going to lose loved ones before their time.
We're all worried and we all have questions. First and foremost, how many of us will get it? How badly? And how do we protect those who we care about most? We've assembled a panel of experts who will pick apart some of these answers.
If you don't stop the spread of this disease, any health system in the world sooner or later will fail.
So can we avoid becoming Italy? Tonight we ask, are we doing enough? So before we discuss the emergency with our panel of experts, let's bring you up to date with the latest developments. The World Health Organization has declared that Europe is now the epicenter of the global pandemic. Spain has declared a state of emergency, and some European countries are closing their borders. Here, the number of new cases has jumped by more than 200 in one day, the highest increase so far. All professional football in England, Scotland and Wales has been suspended, and May's local and mayoral elections in England have been postponed for a year. This crisis is unfolding day by day, hour by hour. But just how did we get here? News from Italy does not tend to terrify us. This week it did.
Italian outbreak of
Today's figures of deaths and new infections tell you why they felt the need to act.
By Tuesday, all of Italy was in lockdown. Its iconic sites emptied. Ski resorts, schools, bars, shops, and all non-essential businesses shuttered until the end of March. Wuhan had come to Europe. This is now the epicenter of the pandemic. Rewind just 3 weeks, and not everyone in Italy seemed convinced by the virus's reach.
Ma perché ci sono gli scaffali della pasta vuoti? Ma che cosa sta succedendo? Manco quando è scoppiata la seconda guerra mondiale c'era stato un panico così.
Today, doctors in Lombardy are hoping that they have enough ventilators for those that need them. These images are all too reminiscent of the quarantined Chinese city of Wuhan. But when the same images come out of Milan, it suddenly all feels very real and far too close. We here in Britain are about to face some very tough choices indeed. While the stock market may have experienced some record falls, most of us have carried on living our normal lives as per usual, going to the pub, taking our kids to school, going to the office, taking the tube. Is all that about to change? And is Italy under lockdown going to be our new normal? Look at a map and the growing number of cases in Italy, Spain, France and Germany makes you feel like it's closing in. And an analysis of infection rates suggests that we may not be far behind Italy, which has over 15,000 cases and over 1,000 deaths. Other countries appear to be on the same trajectory, with Germany, France and Spain roughly 9 days behind Italy, the US around 11 days, and Switzerland 13 and the UK 14. So far, the government has been trying to contain the virus by testing and isolating those infected. But society still continues to gather and schools remain open. The government has hinted all that may change. In order to delay the epidemic's peak and prevent the NHS becoming inundated with cases, the Prime Minister has asked anyone with a cough or high temperature to stay at home for 7 days, with more measures to come later.
At some point in the next few weeks, we are likely to go further, and if someone in a household has those symptoms, we will be asking everyone in that household to stay at home.
The underlying message, it's not if life will change, but when. But other countries are adopting tougher measures right now. Spain is the latest country to declare a state of emergency. And across the Atlantic, Donald Trump has banned all flights from Europe, but not the UK and Ireland.
The European Union failed to take the same precautions and restrict travel from China and other hotspots. As a result, a large number of new clusters in the United States were seeded by travelers from Europe.
China appears to be coming out of the crisis. It has seen over 80,000 confirmed cases and over 3,000 deaths. A combination of locking down cities, contact tracing and social distancing, like staying at home, closing schools and banning mass gatherings, appear to be slowing the virus. And new research suggests it could have been a lot worse. It's now estimated that the true number of cases in China is in fact closer to 115,000. And had authorities not intervened, there could have been 67 times more cases. That's over 7.5 million people. Researchers believe if China had acted 3 weeks earlier, the number of cases could have been reduced by 95%. China's response has earned praise from the World Health Organization. And with the pandemic now declared, it's expressed guarded criticism towards those who don't act decisively.
We have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
Despite being urged to act, Britain's experts believe that taking action too early could actually do more harm than good. None of us can ever remember a crisis quite like this one. We are watching life as we know it grind to a halt. Our hands have become potentially our worst enemies. Hugs are out, coughs terrify, and all the while we wonder, what's next? Who's next? Well, if the public is trying to work out what this crisis means for them, how about hearing from the experts? In this special program, we'll talk to the scientists, economists, and those on the medical front line about what we can all do to keep safe and ask whether it's enough. And just what will the impact of the virus be on our society, our economy, indeed our psyche? But the question on everyone's mind right now is whether the government's perhaps cautious approach is the right one. I put that to Professor Nick Finn, Deputy Director of Public Health England's National Infection Service. And I asked him whether the approach is to allow some people to get infected to develop what's called a herd immunity.
Well, herd immunity is the situation where you get so many people in the population that develop an immunity to a disease that there is no opportunity for the disease actually to become established and spread to lots of people. Normally we do that with a vaccine, so we'd vaccinate everyone so that anyone who was infectious and came into contact with someone who'd been vaccinated, the disease wouldn't travel any further. You can do that naturally, of course, if a disease that's not been introduced before affects a large number of people. And that's really how herd immunity in the UK would develop.
Right, so is that now the policy, to allow the infection to spread, perhaps in a controlled way, to a large section of the population so that we develop that immunity in a natural way?
No. We're not advocating that at all. This is a process of delay. So what we're saying is that people who have symptoms should stay at home for 7 days. And at the end of the 7 days, we take the view that they're not likely to be infectious, and therefore they won't pass on the virus.
But slightly mixed messages here, because we have heard from the government that they do want to build up herd immunity. So which one is it? Are we going for herd immunity or not?
We're going for a tactic which we call delay, which is trying to slow the progress of the virus within the UK. And by doing that, it becomes more manageable. We don't see a very large peak where the NHS could well be overwhelmed. It's in a sense flattening the epidemic curve.
But is there not a danger that in the pursuit of that solution, you're going to turn especially the more vulnerable members of society effectively into guinea pigs for what works?
No, the key issue here is that we are following the science. We're trying to contain the spread of the virus by asking anyone who develops symptoms to stay at home for 7 days. And at the end of that time, they would be no longer considered infectious.
Professor Nick Finn speaking to me earlier. Well, joining me now is John Edmonds, Professor of Epidemiology at the London School of Hygiene and Tropical Medicine. He works on the mapping of infectious diseases and is currently advising the government on the coronavirus. And from California is Silicon Valley executive and writer Thomas Pueyo. He's not a scientist, but his detailed modeling of the virus's spread has set the internet alight with its stark warnings about the rate of infection. Welcome to you both. Let me start with you, Thomas. In California, President Trump, we just heard a few minutes ago, has declared a state of national emergency. What will actually change now because of that?
The country has moved from trying to contain the illness from outside to making sure that now inside it doesn't transmit. And that's the key here. They're realizing, oh my God, it's not that it's coming from outside. It's here, it's spreading, it's everywhere. We need to stop this. We need to stop the transmission between different people. So that's what they're trying to do. They're trying to create social distancing, keeping people spread, not everybody together, so that the transmission goes down.
So can we now expect, as a result of this state of national emergency, the kind of measures in America that we've seen in places like Italy?
I think we will. Italy is different from the US. Obviously, individual freedoms are substantially more important here, but it is the only thing that's going to stop this thing.
Okay, so you welcome this move of the president today?
Absolutely, and not only do I, but the markets are also responding. They were up 4% in the US as Trump was speaking.
Okay, I want to get back to you in a minute because I want to talk about your particular modeling of this virus. But John Edmonds, should we be declaring a state of national emergency here? Something as dramatic as that?
No.
No.
For what gain? For what gain would we get from that? So we're going to get people up into a panic and stuff? We need people to come with us in a stepwise way. This epidemic is not going to be over in a week or a month. This epidemic is going to last for most of this year. And so if we're going to ask people to change their behaviour quite radically, which is going to be very difficult for them to do, it's going to have major economic and social impact on them, then we're going to have to limit the amount that we're going to ask them to do, yeah? We're going to have
limit the amount that we're going to ask people to do.
So we stop the epidemic, or we slow the epidemic right down, but we so that the NHS doesn't become overwhelmed, hospitals don't become overwhelmed. That's the idea. The only way to stop this epidemic is indeed to achieve herd immunity.
Okay, Thomas Pueyo, you're shaking your head, and now you've got your head buried in your hands. What's your response to what John Edmonds just said?
This is like deciding, you know what, this forest might burn, so let's cut a third of it. This is crazy. We want to have 10, 20, 30% of the population catch this. The UK has, what, 66 million people? That's how many people? That's around 20 million people. 1% of these people are going to die. So we're saying we want to kill 200,000 people in the UK. So that's...
I don't think anyone is saying that. I don't think anyone is saying that. But I think there is a real debate in the scientific community going on about the value of herd immunity. So just briefly, what do you think about the value of herd immunity? And can it be created through the measures that the government is introducing right now?
But we need to understand what it means, this herd immunity. They're saying everybody's going to catch it. So once they catch it, they can't catch it anymore. That's crazy. We don't want people to catch it. We want people not to catch it, because otherwise they're going to die. And right now the cases are going exponentially. In a week, the NHS is starting to be collapsed. In 2 weeks, it's going to be completely collapsed if we don't take measures now. And people are going to panic, maybe not today if we don't take the measures, but they're going to definitely panic next week or in 2 weeks. We have 13 days of advance compared to Italy, right? They thought the exact same thing 2 weeks ago. And then 1 week later, they realized, oh my God, this is exploding. They have now, what, 17,000 cases? It's exploding then. They realized too late that they were not containing this. UK now has an opportunity to catch this before the weekend. And we need to catch this before the weekend, because everybody's going to spread this with their friends, with their families that they haven't been seeing during the week. So it needs to be declared now.
Okay.
That's why...
Thomas, let's bring in John. I mean, has he got a point here? We've got to catch this right now.
There's two things. There's two strategies with a new virus, a new epidemic. There's two strategies. One, you can stamp out every single case in the world, every single case in the world, and then the virus, then you're free. You've stopped that epidemic without achieving herd immunity. But you must catch every single case in the world. When the mild disease, that's incredibly difficult. That's the phase that we were in when we were trying to do containment and everybody else was trying to do containment, yeah? Trying to stamp out every single case in the world. it hasn't worked. Yeah, we haven't managed to do that. The next phase, when the genie is out of the bottle, the virus is all around the world and spreading, the next phase, the only other way that the epidemic is going to come to a stop is achieving herd immunity. And let me explain, there are different ways that you can do that, or the natural way that this will happen is that the epidemic will run very fast, and the epidemic will come up and come down very fast. And the herd immunity threshold is reached not at the end of the epidemic. That's what people sort of think. It's not at the end of the epidemic, it's at the peak of the epidemic. At that point, there's not enough susceptibles in the population to spread. And it's very important to understand this one further point, because at the peak, there's so many infectious individuals that they all infect so many other individuals. And so if you can bring the number of infectious people down at the peak, then the epidemic doesn't overshoot. You can manage the epidemic and reduce the total number of the size, so you can achieve herd immunity and not have an epidemic overshooting.
But the trouble is,
you do that by aggressive
This is
measures.
a very important debate, and it's happening right now in the scientific community, as we've discovered on air. But getting away from the abstracts, in practice, what this means is that there will be many, many people, vulnerable people in this community, who may die as a result of what is essentially
There's no way out
an
of it now.
experiment. There's no way out of it.
No, there's no way out of that.
Okay.
So we've given up on the containment phase. That hasn't worked. So, Thomas can throw his arms up as much as he likes, but that hasn't worked, yeah?
Okay, but the point is that we're the only country, as far as I know, that is espousing this model. I mean, the Italians are telling us that they wish they had done it earlier. They wish they had told their population 2 weeks ago, a lockdown means you don't go to the cafe, you don't go to the pizzeria,
And
you
what
stay at
happens
home.
when they release the lockdown?
What does happen then?
It comes back.
But is that
Because you
inevitable?
haven't got rid of... Yes, it's inevitable. If there's virus around in the population, there's infectious people. So unless you've stamped every case out, not just in every case, not just in Italy, but around the world, as soon as you release them out of lockdown, it comes back.
This is a really crucial question. Thomas, what's to say that, once China, people go back to the factories and go back to the offices and the, traffic's back on the streets, that this thing won't come back?
It will come
And possibly worse the second time round?
It will, but the key there is not to have a peak, because when you have a peak, you have hundreds of thousands or millions of people collapsing the NHS. And when you do that, all the people cannot share the ventilators that they need. All the people who are having heart attacks right now cannot get to the ER. And so what we need is not to have this huge peak, collapsing everything, killing everybody. What we need is to, what we call, flatten the curve. Slowly grow these cases, contain it, so that they can be spread over time. We can achieve herd immunity, not in 2 weeks going crazy, but in 6 months, in a year.
But that's what the government, sorry to interrupt, Thomas, but that's exactly what the Prime Minister was saying yesterday in his rather colourful language. They're saying we've got to flatten the sombrero. That's what they're trying to do here by delaying the virus.
That's right. And how do you do it? You need to take measures where people don't talk to each other, they don't interact with each other, so they don't transmit the virus. So you need to take measures now to avoid people interacting. Now.
Doesn't he have a point, John?
Well, it's exactly the point I was making. So the only way to do this is to achieve herd immunity, to stop this epidemic, and you impose social distance measures to slow it down, to bring the peak down, to spread it out over time. But if we're going to bring the peak down from a very high point and spread it over time, then we're going to spread it over a very long period of time. 6 months to a year is what we're going to be living with this epidemic for that kind of length of time. And so if we're going to ask people to take these really extreme measures, then we don't really want to ask them to do it before they have to, because they're going to have to do it for a very long time. Now, the epidemic is moving fast, and we will be asking them to do these measures very soon.
Let me ask cynically whether there is an element of this that the government doesn't want to shut down the economy, sacrifice the economy completely, as we've seen in other countries, while it is trying to find the right solution.
Look, there's no easy way out of this. All of these are going to be hugely damaging to people, to people's lives and the economy. And there is, of course, a balance. And so you have to try and get it, get the epidemic, manage the epidemic as best we can, and manage the other aspects of, we have to manage the economy, of course we do. We can't ignore that completely.
But our priority is to save lives right now.
Of course it is.
Richard Horton, the editor of The Lancet, prestigious medical journal, has said that our policy at the moment, the government policy, is playing roulette with the public.
Yes.
This is what he said.
That's a kind of easy thing to say, isn't it? That's a very easy thing to say. But I don't think they are. I think what they're doing is trying to take it sensibly, stage it. Look, you'll see measures coming in very fast now. The epidemic is moving. You'll see measures coming in. So we will be asked to do, and all of us will have to take care to do those things.
When will those measures come in, do you think?
Very soon now.
In the next few days?
Certainly within a week or so.
And these will be lockdowns of cities,
no, I don't think
closing universities. We're not going to go that far.
No, we're not going to. Not initially, but we may get there. Yeah, we are going to be asking people to take extra measures. They've already been flagged up. You had on your VT that you showed just before the Prime Minister talking about the next measures that might be along the line.
So you don't think we're dragging our feet on this, with possibly dangerous consequences?
I think we're trying to stage it as best we can.
Thomas, if we impose restrictions tomorrow or the day after, this weekend, as you just said, is that going to be early enough in order to stop us from becoming Italy in 13 days' time?
With the current number of cases that we have in the UK, around 800, and the growth rate day over day that we have, in a week we have 6,000 official cases, and in 2 weeks we have 45,000. We have today more cases than Wuhan had when it shut down. What they did when they shut it down was completely cut it. You can see the growth in true cases going dramatically down overnight. And now China has only a few dozen cases every day. They decided we're going to go aggressive now so that later on we don't need to be suffering all these consequences. And that was the right move because this is growing exponentially. So what you need to do is when it's growing exponentially, you catch it early and you really, really go aggressive against it. You don't let it fester to collapse the NHS.
Okay.
If you do that, then you can relax little by little over the weeks, over the months, the measures, so that now we have more capacity on the NHS and the cases are spread out over time. And
just, Thomas, explain to us, you wrote this article that went viral on the internet, your modelling for why these, for explaining why the numbers of infections will double every 2 days. How do you explain that, based on the China model?
It really depends on what's happening at every moment. Right now, this thing is growing really, really fast in the UK, right? We have 800 cases. It's growing at 33% every day. That means in 3 days, you get 1,900. So it's more than doubling in the next 3 days. And so what's happening is early on, when this thing is really catching up, cases explode and they grow at, say, 2x, they double every 2 days. Right. And this is the situation in which the UK is today. It is the situation in which Italy was a week ago. It is the situation in which Spain is right now.
Okay, John, why are you shaking your head at those numbers?
It's true if you just look crudely at the numbers, that the numbers of cases are doubling about every 2.5 days. But that's because they're doing more contact tracing. The actual underlying rate of doubling is more like about every 5 days.
Right, OK. We've got to leave it there. John Edmonds, Thomas Peyo, thank you very much indeed. Our ability to fight this disease comes down in large part to the resilience of our healthcare system. The NHS maintained that they have measures in place and are well prepared to cope with the coronavirus outbreak. But how do those working on the front line feel? This programme has surveyed almost 1,000 NHS staff about preparedness. As the Prime Minister warns that we will face challenging times, many in the NHS are worried too. 99% say they don't feel the NHS is in a good position to face the rapidly increasing numbers of cases.
The government line that we are ready or prepared is laughable.
The public are unprepared for what will be an avalanche in the next week or so. Good luck to us all.
In Italy, doctors are worried that they could run out of ventilators and will soon have to make difficult decisions about who gets treatment. And in our survey, 92% of NHS workers told us that there weren't enough specialist facilities or staff to treat coronavirus patients in their own healthcare establishments.
Thousands are likely to die. We have nowhere near the number of critical care beds or resources to cope with even a fraction of the patients likely to get coronavirus.
But it's not just equipment to treat patients. Our survey reveals many are worried and angry about the lack of protection for staff as well. 97% felt there wasn't enough keeping them safe, with only 14% saying that protection equipment had been freely available.
As a GP, I feel exposed and vulnerable with completely inadequate protection.
Government PPE equipment is useless. Paper masks and some plastic aprons. Might as well wear a party hat from a Christmas cracker.
Feels like GPs are the canaries in the coal mine.
With the government stopping short of locking down communities, our survey shows that 94% felt the UK response hasn't been quick enough, and 95% felt that the measures weren't strong enough. The fears of doctors working in the NHS and the experience of medics in Italy, where the virus has swept especially through the north of the country, demonstrates exactly what they might end up facing. I've been speaking to Dr. Giacomo Grasselli. He's medical director of the intensive care unit at the Policlinico Hospital in Milan. He hasn't seen his family or children for 3 weeks. I asked him exactly how many patients he's dealing with.
800 and something, who are treated in the ICU, and most of them, like 80% of them, are intubated and under invasive mechanical ventilation. Then there is, I think, at least 1,500, but probably more, patients who are receiving some form of non-invasive respiratory support, like non-invasive ventilation or CPAP in the wards or in the emergency departments.
So to put it bluntly, have you got enough equipment and enough beds to deal with the numbers of patients coming in, or not?
Well, until now, we've been able to deal with this huge number of patients, and we have enough equipment. Clearly, if the number of patients keeps increasing like this, we will get to a point, and I don't know when this point will be, where the number of patients will exceed the resources. But Lombardy is a very rich region, very modern region. It's probably one of the richest regions in Europe. And I think that our healthcare system is quite good, but no matter how good and modern or efficient you are, if you don't stop the spread of this disease, any health system in the world sooner or later will fail, because you are like invested by a tsunami of patients. A lot of patients, all severe and all, in a very limited period of time.
So what would your advice be to doctors and indeed government officials in this country, in Britain?
Every country should get ready to this. I have the feeling that people are like thinking that, well, this is not going to happen to me, which clearly I hope that it's not happening to anyone. But unfortunately, I'm not sure that this will not happen to somewhere else. So the most important thing is to get ready.
Dr. Grasselli speaking to me from Milan. So are we ready here? Well, to discuss that, I'm joined now by doctors who might end up, like Dr. Grasselli, on the front line of this battle against the virus. Tom Dolphin is a consultant anaesthetist in London and is a council member of the British Medical Association. And Katie Bramall-Stainer is a GP in Hertfordshire, a county with a cluster of coronavirus infections. Welcome to you both. Let's first of all start with the survey that we just broadcast. I mean, these are really depressing numbers in terms of the confidence of frontline staff like you in the ability of the NHS to protect them and us. Do you agree with those numbers?
I think it's fair to say I do agree with those numbers. They speak the truth. If you look back to the summer, I remember a Wednesday afternoon in August when all practices across my region were sent a black alert because the hospital trusts were overwhelmed and had queues of ambulances outside the front door. And here we are, 6 months later, facing an unprecedented challenge.
Tom?
It certainly matches the experience that we're having, and the BMA is hearing from doctors on the front line that they're not getting access to the protective equipment they need, the PPE, the face masks. We've heard from the government that it's going to be rolled out, but it's not there yet. But the patients are starting to come in already.
This is deeply alarming, and we're dealing with a matter of days here, certainly weeks, when this could get as serious as Italy.
This is an unprecedented situation. There is a worldwide shortage of PPE, so it's difficult to see where we can get it from, but it's the government's responsibility to look after the healthcare workers so that we can look after the patients.
Are we now paying, in this moment of crisis, for 10 years of austerity in the National Health Service?
I think that's unquestionable. We've seen an absolute catastrophic decline in staff and resources over the past 10 years that's been unprecedented. And unfortunately, the government is going to have to reap what it's sown.
we know that we're not in a great starting position. If you were going to deal with an epidemic, you wouldn't start from here. But we are where we are. We've got the people that we have the kit that we have. We need to get on and do what we can with what we have. The government's got an opportunity now to do as much as it can, trying to delay, as we heard from the last guest, trying to delay the peak so that we can make sure that the number of cases coming in each week doesn't exceed what we can deal with. We can try and do that. We've got an opportunity.
So are you relieved by the government strategy that they're trying to basically, we're not going to have a complete lockdown. We're just going to, ride this one out, as it were, with measures here and there, but not be as draconian as some of the other countries that have dealt with this. Is that good news for you, or do you think that's gambling with people's lives? Tom, you first.
I'm not a public health expert, so I'm not the one to say whether it's the right strategy or not. We do know that the curve needs to be flattened. We need to make sure, instead of having a big peak, that we have a slower curve of people coming in. Whether this is the right way to do it, we will find out in future. Different countries are doing it different ways. They have different populations, different advisors, different systems. So I think it's a very fluid situation. It's likely to change in the next week or so, and we'll see different solutions coming in.
So we had a story tonight on Channel 4 News about these testing kits, self-testing kits that are being rolled out by a company. Apparently, 1 million of them have been sent to South Korea. The NHS here, I think, is looking at them. But when I spoke to the, one of the officials from Public Health England, he didn't even know about them. So self-testing kits where you test yourself and you get results in 10 minutes. It sounds like a good solution, but there are all sorts of issues, aren't there, with that sort of thing? Would you welcome such a thing?
Well, it's not a solution, but I think it's not about welcome it. It's going to be essential.
Essential?
Because the alternative for front-facing clinical staff, because the alternative is you're going to have up to 1 in 3 NHS staff who are having to self-isolate, who don't know if they've been exposed and therefore immune and aren't in a position to come back to work. If they're able to exclude it or to confirm it, and then they can return to work potentially.
So testing, you would say. That's the most important thing.
For frontline clinical staff will be helpful in terms of keeping the show on the road.
Right. What do you think, Tom?
I think the testing kits will be very helpful. We're going to find ourselves in a situation, maybe in a few weeks, maybe in a few months, where the number of patients who need care is going to exceed what the NHS is able to provide. So anything we can do to keep as many staff in the hospitals, in general practice, seeing patients, is going to be essential.
Now, in terms of people staying at home, so you get your cold, you get your cough, you get a fever, the advice is stay at home for a week, but not to ring 111 or indeed demand a test. Now, why are they doing that? Because the previous advice was get yourself tested as quickly as possible.
This will overwhelm the system. We would really need the public to work with us. This is unprecedented for us. We're all quite apprehensive as a medical profession. What's really important for the general public is to be careful, cautious and responsible. Only call 111 if you are dangerously unwell. Ensure that you've got
So this is to protect the system, to protect the phone lines from being clogged by something which is, not essential.
By protecting the system, you're going to protect the majority of the population by delivering care to those who need it most.
And very briefly, Tom, we mentioned this earlier a little bit. How worried are you about the lack of protective gear for some of the frontline staff, or indeed the danger that they face?
When you become a doctor or a nurse or other healthcare professional, you expect to come into contact with infectious disease. The important thing is, because the system is going to be so stretched by coronavirus, we need to make sure that healthcare staff are not all off at the same time with coronavirus-related disease. And that's why we need the PPE. It's to protect us so that we can carry on looking after patients.
OK, thank you very much. Tom Dolphin, Katie Ramos-Steiner, thank you very much indeed for coming in. Let's just remind ourselves what has been happening around the world. The virus is spreading around the globe, bringing life as we know it to a grinding halt. Wall Street had its biggest one-day drop since 1987, and stock markets around the world have suffered similar falls. Walls, borders, barricades and travel restrictions are now all the rage. Airports are deserted, planes grounded. But COVID-19 has the run of the place. It is stubbornly global. Politicians around the world are testing positive for COVID-19. Broadway is turning off its lights. Disney parks are shutting their doors. Schools are closing and supermarket shelves are left bare as multiple countries go into lockdown. The streets of Madrid are empty, the Vatican deserted. Even Mount Everest is closed for business. Will this empty indoor life become the new normal for us in the UK as well? Astonishing images, and we're going to discuss the impact now. Joining me is the economist Katie Martin, who's capital markets editor for the Financial Times. Ben Voyer is a behavioural psychologist at the London School of Economics, and from her home in North London is the writer and broadcaster Joan Bakewell. Joan, if I could start with you. You're self-isolating at the moment, I gather. Why is that?
Yes, I had a pre-existing condition for which I was receiving treatment from the doctor, and she advised that I should therefore isolate myself to make sure that that I was safe. I'm quite old. I'm, as it were, part of the risk community, and I think that's very wise. And I'm happy to do it, although, of course, it's massively inconvenient.
How long will you do it for?
Well, I'll do it as long as they tell me. I mean, I've been listening to what people have been saying. I can see this is no longer an inconvenience. This is a major issue, a global issue of which I am part, and to some extent as at risk in the forefront of it. So I will do what I'm told. I will read all about it, and I will listen. And I think it's very important that people in my generation do listen, because in a sense, the health services, the NHS, the support systems aren't adequate. So we are going to have to support each other and give each other comfort, help, advice and support.
It's interesting, isn't it? Because whenever we hear about casualties, people often say, you know, the age of the person who died, and then they talk about underlying conditions. You know, as someone of somewhat advanced years, when you hear those words, do you feel that society is respecting you as an elderly person? Or is there a kind of, or do you sense a kind of almost a sense of relief that it's not younger people who are being affected by this to the same extent?
Well, when you're moving towards the end of your life, you have a perspective on it that is quite different from younger people. So I'm really much more concerned with younger generations. However, I'm prepared to do everything that I can for myself and my own generation to keep ourselves healthy and operating in society, rather than being a burden and disobeying and feeling it's just a nuisance, it will pass. We have to be realistic about how serious this is for our generation as well as for every other generation.
Indeed. Stay there, Joan. We're going to talk about all the other broad impacts of this, and we don't have very much time to do it, so let's try and rattle through it. Katie, we've spoken in the studio quite a few times in the last 2 weeks. I mean, the economic impact of this, and I'm not just talking about markets going up and down, but the economic impact on tourism, on hotels, on airlines, you know, on small businesses around the world. This is seismic stuff, isn't it? Can we recover from it?
Well, we're going to have to. But as you say, the sort of level of alarm that's coming out from the corporate world now, from big companies and small companies around the world, is seriously worrying. You're seeing companies like BA say, you know, this is a threat to us. This is like nothing we've ever faced before. This is a genuine business
This is Lehman
issue.
Brothers on steroids sort of thing.
The thing with Lehman Brothers on steroids is that Lehman Brothers was a financial crash, and you could basically fix it with financial stuff. This is not a financial crash, but the markets are treating it almost as if it's the same thing. What I mean by that is that markets are moving around as violently as they did when Lehman went down. It's not just been a normal week in the office, it's been very hairy out there.
Ben, there was that, the famous Roosevelt comment, I think at the height of the Great Depression, what we have to fear most is fear itself. It seems to me that there's quite a lot of that stuff going on in the markets, but on the other hand, fear is also probably keeping us alive, isn't it?
It is. I think what we're seeing at the moment is that it's tackling into our fight or flight kind of reactions. People are in a state where if they are going to act in a sensible way, they need to feel the fear. If they don't feel the fear, there is a risk that they don't act and act against society.
And that's why the Prime Minister presumably said what he said yesterday, which really, put the fear into people. And that's why the World Health Organization said very, openly, we've called this a pandemic, even though not much will change the way we approach this, but we want you to wake up.
Absolutely. We know that fear creates a prevention focus in individuals, and that means that they're going to start acting differently and look more for what could save their life and the lives of others.
Okay. Joan, when you're watching, I don't know how much television or you watch at the moment, or radio you listen to, or Twitter you follow, I mean, it must drive you mad, especially in self-isolation. How do you deal with the fear that it seems to be engulfing all of us in society?
Well, what do you do about fear? You confront it, you talk about it, you don't hide it away, you admit it, and you see what you can do about it, and you act upon it. That's as much as we can do, and it's all within human capacity to take it on board. We need to support each other. I'm in touch with other people of my generation. I ask them each day how they're doing, what gel they're making, how do they go out at all. One of the terrible things is being locked in your home so you can't go out for a walk. Something I disobey. I do go out for a walk. I need fresh air. So it's a matter of organizing your life to deal with it day by day. Fear is a long-term undermining sensation. But if you deal with it day by day, minute to minute, do what you can, that's a way of coping.
Is it isolating us, Joan, or is it actually creating a sense of community that wasn't there before, perhaps, briefly?
Both. Well, and because we've all got mobile phones and a lot of us are on Skype and talking to each other, we're all in touch. The internet, Twitter, Facebook, these are really valuable ways of contacting now. There's loads going on, and I read about all the medical stuff on Twitter and on the threads that come up there. So I'm not isolated, even though I'm on my own in my home.
Katie, just briefly before we go to a break, I know this is a big concept to throw out there, but globalization, the only global thing at the moment is the virus. We've got borders going up left, right and center, barricades, flights being stopped. Very briefly, is this the end of globalization?
I mean, that's probably too big of a question to answer. I think the big hope is that we will get back to normal, but I think what's dawning on people now is that's going to take a really long time. We're all much more interconnected than we realized, financially, in terms of commerce, everything.
I'm going to ask you all a very simple, deep question at the end, and you're going to have to give me a brief answer. How, Ben, will this change everything that we do?
I think we could witness a change in values. The Western world is very individualistic. We care about ourselves first and foremost, and we could shift towards more collectivism, caring about others, taking care of the community, rather than our selfish behaviours.
You're that optimistic?
I'd hope so.
OK, Katie, what about you?
I should just correct you really quickly in saying that I'm a journalist rather than an economist. Yes. But I think what we've learned from what has been quite a humbling experience in markets over the past few days, traders and investors have spoken about this being a diabolical experience, is that we've been looking in the wrong places for the next market crisis. We've been looking within markets for the seeds of the next crisis. And actually, that crisis has emerged from real life. And I think it's a big lesson to investors that you have to look at the real world to find out where the real risks are, and that includes things like pandemics, and it includes things like climate change.
Let me ask a supplemental to that. Greta Thunberg wants a world where we fly less and we produce less and we live more locally. And I asked her this the other day, could this be the result of that? She didn't want to engage in that question because she didn't want the headline. But is that not the case, the possibility?
I can understand why she didn't want to engage with it, because it just feeds the kind of nonsense conspiracy theories that this is all a hoax that's been cooked up by the kind of Green Brigade, which is not the case at all. But it's certainly the case that at least short term, we are living much more locally. We're not travelling. It's a very different world.
Joan Bakewell, how's the world going to change, if it will change at all, after this?
Changed utterly. There's no going back. There's no normal anymore. Everything has to be rethought. Global government, global economies, the way we behave one to another, attitudes, the cheap tricks of politics have got to be laid aside. Something serious is happening, and it needs being addressed seriously by everyone.
In a positive way. Do you think there's a silver lining in all this then?
Yes, every catastrophe is a new opportunity. I mean, there is a new opportunity, but there needs to be some heavy thinking, some really serious addressing, and not playing at political games. This is serious, and there are plenty of people who can address it wisely, and we need to listen to them and indeed share in it too.
But after SARS, for instance, that crisis ended, and then Asia went back to what it was doing before, and nothing really changed very much.
Things change all the time, don't they? We perhaps don't realise at the time. We thought it was going to be the planet that brought the crisis. It isn't. It's a pandemic, and it's here. So it's with us, and we never anticipated it. They didn't make science fiction programmes about it, but now they can, because it's real. This is what we are part of. This is the future. Okay.
Joan Bakewell, thank you very much indeed. Katie Martin, Ben Voyard, thank you very much to all of you for coming in. And thanks to all our guests in the programme, and thanks to all of you for watching. We are all on a learning curve here right now. Yes, these are very bleak times, but we will end this programme on an uplifting note. Why not? Residents of Siena in Tuscany confined to their homes, singing to each other across streets that are now deserted. In that way, at least, we could all aspire to become Italy. Good night.
Viva